So this is the gap between the two bellies of rectus. And then if you follow this around, you see that the fascia that holds the other abdominal muscles, so the transverse and the oblique muscles, will follow on the side round and then blend with the thoracolumbar fascia. So that is the continuity we're really talking about. And therefore, if you want, if we give patients exercises who after pregnancy have got a gap between the abdominal muscles, which is physiological after about the 5th month of pregnancy, that you do get this gap between the two bellies. And then we try and get them to use their oblique muscles in order to close this gap again. But if the fascia that holds all of this is not functioning properly, so if it can't glide as well as it should do, then we can't recruit these muscles. The woman can do as much exercise as she likes, but she won't be able to recruit the muscles effectively. And the same is true for the thoracolumbar fascia. So we're having these insertions into the thoracolumbar fascias, the anterior leaf of the fascia going to the transverse process, the posterior leaf going to the spinous process. So if we've got dysfunctions anywhere there, we won't be able to recruit the muscles to pull it back together.
Interestingly, when I was looking at the outline for the presentation earlier on, and I was looking at the commonly prescribed exercise remedies, I was thinking there must surely be a chance that some of these exercises are going to worsen the problem.
Yes.
Because all the muscles contracting around the side and the back of the body here are going to be acting to pull those rectus muscles apart.
Yes.
Okay.
Yeah,
so do you see that? Do you see that people go away, they get standard exercises from a sports therapist or a personal trainer or something, and they end up with a worse problem?
Sometimes. I mean, the good thing about the situation is that mothers often can't do exercises as much as they have been prescribed, because they're nursing the baby 6 times a day and they're waking up every 2 hours or so, and so they don't actually do the exercise as much as they've been prescribed. So that sort of makes the problem, ameliorates that problem a little bit. But we do often, midwives always tell patients that they shouldn't use the rectus muscles themselves, they shouldn't sit up straight. It's like we do try and give them advice that they don't do exercise that makes it worse. There has been, in 2014, there's been a meta-analysis of exercise-based therapy for diastasis recti, which showed that there's no evidence that it works. So in a way...
This is a world we're familiar with, really, isn't it?
Yes.
Lack of evidence.
Yeah, well, it is lack of evidence, but it's also that I think we sometimes critically need to look at when we do interventions that we've done for many years, maybe for 30, 40 years, and then there is sort of the evidence that they actually haven't got an effect, then sometimes I think we might need to drop interventions that don't work.
Yeah, there comes a point where the evidence doesn't simply say that there's no evidence that it works, it becomes evidence that it doesn't work, surely.
No, exactly, and that is what this meta-analysis was showing. And so we've had that for 10 years, that evidence-based medicine would be not to give them exercises.
Any exercises at all?
Any specified exercises for that.
Okay. Out of curiosity, you must have seen a lot of this, given your previous profession and what you specialise in now. What are the long-term effects of doing nothing about diastasis recti?
Oh, there are a lot of side effects as far as sort of stability of the trunk go, and therefore then, back pain is probably your biggest thing, not being able to do other sports safely because it will affect balance, it will affect posture, it might affect visceral function because obviously the trunk is sort of creating a pressure field together with the pelvic floor and the thoracic diaphragm, and so if the visceral field in the middle will probably not be as happy as it could be. So not doing anything will not be good for overall health. Right.
And I suppose another perhaps obvious question is, if this happens to every woman in pregnancy, why doesn't every woman suffer from diastasis recti?
Because I think there is a fairly clear answer on that, because I think it's that their fascial health is different. Mm-hmm. So some women will, especially sort of in their thoracolumbar fascia, develop quite a lot of densifications because the pregnancy might be very strenuous. Depends on how much amniotic fluid she has, how big the baby is, how possibly overweight she was herself. So some women find pregnancy very strenuous. And so they might develop more densifications in the fascia, especially at the back, to counteract this weight of the growing belly. And then this fascia is dysfunctional after the pregnancy, and therefore it won't allow the recruitment of the muscles. Whereas other women might not have such a big belly, they might move more, they might eat more healthily. What we eat influences the pH of our connective tissue. If that's a good pH, the fascias will stay gliding, and they will function well.
Right.
So, and then it obviously depends on previous injuries, posture, how much mobility did they have before. I mean, we have a lot of patients who don't move enough, full stop. And then starting to move just after pregnancy because they want to lose their mummy tummy is not going to work immediately, because it might have been that the fascia needed rehabilitation in the first place.
Right.